Welcome back. This is the third and last chapter of Module 3. In this chapter, the third stage of dental implant treatment is discussed. This stage is the implant restoration. After achievement of osseointegration, the restoration of the implant can be done. There are 3 occlusal loading protocols depending on the period of osseointegration. The immediate occlusal loading protocol achieves restoration in occlusal contact within 2 weeks of the implant insertion. Early occlusal loading refers to restoration in occlusion between 2 weeks and 3 months after implant placement. Delayed or staged occlusal loading refers to prosthesis with an occlusal load after more than 3 months after implant insertion. There are 2 techniques for taking the impression. The first is called the pickup or direct impression technique, also known as the open tray type. The second is the transfer or indirect impression technique, known as the closed tray type. A cross-section in the impression shows the clear difference between the open tray coping on the left and the closed tray coping on the right. During the first visit of the implant restoration stage, the following steps should be achieved. The healing button should be removed, the impression coping is placed, and the impression is taken using the open or closed tray. The impression of the opposing arch is also taken. Pastebow records and occlusal relations are registered, and all records taken should be sent to the dental lab for construction of restoration. After receiving the restoration or prostheses, the patient should be called. The following should be assessed during the placement of implant restoration. The fitting of prostheses to abutment should be checked visually or by tactile sensation with a probe, and confirmed with a radiograph. The appearance of the tooth should be checked in terms of tooth form and tooth shade. Occlusal scheme should also be checked and adjusted, and each type of restoration has specific occlusal scheme recommendations. After properly fitting the restoration, the patient should be reviewed after 1 to 2 weeks. We have reached the end of Module 3. Thank you for listening, and see you in Module 4.